Hi, everybody. Welcome back. Good morning. This is Jen Kovich-Bordnick with the eHealth Initiative. Welcome back. It's great to have everyone here. We're going to give everyone just a moment or two to log on. If you want to jump into the chat room and tell us where you are logging in from, that would be great. We would love to know where around the country and where around the world everybody is today. So let us know where you are logging in from. We are here in Washington, D.C., and we've got two incredible speakers with us this morning from, I believe, Boston and California. Great. Good morning, Louisville, Kentucky. Great to see you. San Francisco. Yay, Amy. So glad you're here. New York. Wonderful to have you here this morning. Great. Kansas. Okay. Colorado. Any Atlanta folks here? I know we had a lot of really excited baseball folks this week. Colorado, welcome. Oregon, great to have our West Coasters waking up this morning for this. Good morning. Minneapolis, great. Minnesota, Arkansas, all right. Great to have you here, guys. Good morning. Canada, all right. So we are headed out into the international. Great to have our Canadian contingency here today. I'm always looking for a Middle Easterner, so hopefully we have our Middle Eastern contingency here today. Arkansas, welcome. A lot of Colorado. Thank you. Good morning. We're going to give folks just a moment to log on. Good morning. Welcome back. It's great to have everybody here this morning. Welcome. So what a great day we had yesterday. We had really inspiring remarks yesterday from a number of individuals in the field doing really truly meaningful work to move digital health forward with different communities all across the country. And today is going to be just as tremendous as yesterday was. We've got a great lineup for you today. Immediately following this session this morning, we're going to hear from 1A, Dixon, our own 1A, who's going to be moderating a panel on how to increase access to diverse providers. We will also hear today from Alice Leiter, who's got a great panel on inequities and how health data is used and looking at the bias that sometimes is present and how to address that issue. A really interesting panel there. I'll be moderating a panel at 1 today on my favorite topic, virtual care, and using virtual care to expand access to vulnerable communities. A real star-studded panel. I hate to put a plug in there for my own, but join us at 1 o'clock today. Don't miss that. We've got a great panel from our very own Catherine Pugh, who's going to be moderating a panel from Capitol Hill. I'm sure everybody wants to hear from Capitol Hill. We've got a great topic later on why the internet just isn't enough to close the digital divide, and we will round out the day with a discussion on payment models and really wrap up the day with the incredible Roy Weathers at the end of today, who's going to have some inspiring remarks for us. So I want everybody to grab your coffee and snacks, strap in for a great day. We're here day 2 on our Whova app, so feel free to log in and out and join the sessions that you want to join. We are going to kick it off, though, this morning with 2 of my favorite people this morning from our very own board of directors, Amy Mcdonough and Chris Joshi, 2 of our directors, with some inspiring words and a really important announcement. I'm going to begin by introducing Amy, and then Amy's going to turn it over to Chris later. But for those of you who don't know Amy Mcdonough, who is our board chair, she is the managing director and general manager of Fitbit Health Solutions at Google. And Amy leads the team that works with employers and health plans and systems to design solutions and programs, figuring out how to engage people, positive return on investment and health outcomes. But I think more importantly, she's really an inspirational leader, and she's been in this field for over 20 years. She is an unassuming, genuine leader, just a wonderful role model and mentor. And she's a type of person I like to think of as bold without bluster. Just really a wonderful human being. I actually asked a few board members to describe her, and I got back words like amazing, brilliant, compassionate, and a true leader. So with that, I'm really delighted to turn it over to Amy. Amy.
Wow, Jen, thank you. It's a good thing I had my video off because you had me blushing there for a minute. Thank you for that very kind introduction. Really, really appreciate it. And it means a lot. So thank you. I'm so thrilled to be here to welcome you all to today's eHI Health Equity Summit. I want to thank Jen, the team at eHI, and all of our presenters and attendees for taking the time to focus on the critical topic of health equity by joining today. COVID-19 has shined a light on deeply entrenched health disparities, providing an opportunity for us all, including technology companies, government, public health, researchers, and those working directly with communities to come together and seize opportunities and solutions to achieve health equity. At Google, millions of people trust and turn to us for information, tools, and technologies. And we have a responsibility to develop research, products, and partnerships that give people equal and fair opportunities to be as healthy as possible. Google's committed to health equity and building products that can benefit everyone. It includes considering factors that also have an impact on one's health, from education access and financial literacy and stability to the surrounding environment and access to healthy foods. We're very focused on the public health community and researchers and supporting them with data, tools, and resources to create conditions to help everyone be healthier. That's all long been the mission of Fitbit for about 14 years, is how do we help everyone in the world, with the emphasis on everyone, live a healthier and more active life. And we really mobilized during COVID-19 across Google. Just a few examples of the things that Google's really doing at scale, given our reach. Exposure notification technology, community mobility reports available across more than 100 countries, 68 languages, to help governments around the world. Vaccination search insights and access data sets. So really making sure that there's vaccine equity planners, health equity trackers, and also google.org. So giving more than 800 million in ad grants to help governments and public health reach audiences with timely messages. And additional grants to on-the-ground organizations to really help support, again, this the important topic of health equity. One particular initiative, if we can flip to the next slide, that I wanted to highlight is something that Fitbit announced earlier this year, and this one's near and dear to my heart because my team led this initiative. It's called the Fitbit Health Equity Research Initiative, and it aims to help address these issues by supporting underrepresented and early career researchers who are actively working to make change in underrepresented and under-resourced communities. So while digital health adoption is accelerating at a rapid pace, somewhat fueled by COVID-19, health disparities continue to widen, and researchers often struggle to obtain the necessary funding. So we announced 6 award recipients of our first Fitbit Health Equity Research Initiative. You can see them noted here. What we're really proud of here is that they're representing, again, early career researchers, but the range and diversity of health issues and populations that you can see demonstrated here. So maternal morbidity, mortality in Black and Hispanic women, heart disease, type 2 diabetes in Latino communities, sleep health among transgender youth, and healthy behavior change among adolescents. So a really wide and diverse range of resources and institutions really supporting that research. We've supported researchers for more than a decade and have well over 1,000 health studies by researchers worldwide. But even despite that, we know that there's much more that we could be doing. And that's really the initiative that you see here that we are really excited to have just recently awarded just a couple of weeks ago now. So we'll be sharing more about the research as they have early results and as those start to come out and as they start to publish information. So look for more to come from that. We have a great agenda today that you heard a little bit about from Jen, and I really look forward to the conversations and connections it brings over the course of the day. With that, I'd love to turn it over to Chris Joshi, who will talk a little bit more about some exciting announcements we have from eHI. Thank you.
Thanks, Amy, and hello, everyone. It gives me great pleasure today to talk for a few minutes about a topic that is so important to everything we do. It's about our digital health equity pledge. So we all know that technology is a great leveler. So much of what we all do every day, especially if you're in the tech industry, is about introducing new technologies that improve access, affordability, and quality. But as we speed things up, we disrupt things, especially with new technology like AI. We need to ensure that we don't unwittingly or through oversight end up with unequitable outcomes. So I'd like to talk for a minute about the Health Equity Pledge, which I'm proud to say many of our members have already signed. And I'd like to talk about what's in it, why you should sign it, and welcome you all to join in. Sometimes some things we take for granted, some things we assume, like the importance of equity in healthcare, are easy to just put in the back of your mind, right? It's always there, you always know it's a good thing. But we feel that there are moments when it's good to reaffirm what we stand for. So what is in this pledge? Well, the pledge addresses some very basic needs in healthcare today. First, accessibility. Ensuring that the new technologies that we're building are accessible to all, not just the tech-forward crowd that often is, at the front of the line for all new things. It's about diversity, making sure that our efforts reach everyone and represents the diversity of our patient populations, and making sure that new technologies and new research is more accessible in the community. This is an area of great personal interest to me and to everyone at Change Healthcare. When I brought this up with our leadership team, there was just resounding support for this pledge and the spirit of the pledge. It was about making sure that all the technology we build, all the nationwide networks that we run, are not disproportionately benefiting one population over another, but can actually add value across the board and really serve as the leveler that we want technology in healthcare to be. Research in the community is a big gap that I'm personally working on quite a bit these days, understanding that when new vaccines and new therapies come out, often there's not enough trust in the communities because the research that was done to produce these new drugs and new therapies was not visible in the community. So it's just an example of why diversity is important in everything we do. And it's just not something that we can look at the very end, at the end of the line to say, well, how do we make this available to everyone? Well, let's make sure that everyone's involved in the process of creating new technology and new therapies. It's also about respect. It's about building trust and meeting people where they are and respecting their history so we can better understand how to serve them. And finally, it's about public policy. We all know that policy can sometimes be a slow tool, takes a long time to work, but it's an important tool. Over many years, if you have good public policy in place, it can make a difference. And these days, the policymakers in DC and elsewhere in the 50 states are all looking for direction, and they do listen to what the eHealth initiative has to say. They're listening to what you all have to say. So if these objectives sound somewhat obvious to many of you, it is because they make common sense and they align very strongly with our mission. So let's bring equity from the backs of our minds to the forefront. And one way of doing that is by joining this pledge. So by joining eHI, you already have made it pretty clear that you're passionate about digital health. I hope that you'll be equally passionate about making your voices heard by signing the digital pledge, the digital health equity pledge. And we already have a great list. You can see all the organizations that have signed already. And I want to say a big thank you to them all for taking the leadership here. But I hope that this list grows by leaps and bounds by having you all join us by signing the pledge by December 1st to make your voice heard. So with that, I'll turn it back to Amy. And thank you very much for paying attention to this pledge.
Great. Thank you so much, Chris. That was just wonderful. We really appreciate your support at Sport of Change, and we would love to have as many of you and your organizations as possible sign on. We've put a link in the chat box there, so please go to the link, click on it, and sign the pledge for your organization. This is really wonderful, Chris. Really appreciate your time here this morning.
Anytime.
And For the rest of you, we would love to have you join our next session. The White Male Doctor will see you now, utilizing digital health to increase access to diverse providers. A fantastic panel. You don't want to miss this. 1A Dixon, our incredible 1A Dixon, will be facilitating this panel this morning. So please click on the link and go join. And we look forward to seeing you today. Thanks, everybody.